Good evening, friends. So, meeting again with the aphorisms, and in last lecture we have finished with the sixth aphorism along with its footnote, where he has explained one important quality of the homeopathic physician, that is the unprejudiced observation. Unprejudiced observer is the person who is without bias, doesn't think about anything unless and until he finds it out the truth. He never judges with his mind. He never judges with his memory. He never uses intellect at that time. And because of which to become unprejudiced becomes simple task. And what Hahnemann explained over there, that you have to understand what is altered state in of the health. That is only the thing which you have to take into consideration. You don't have to take into consideration all the things, but basically you have to understand what is altered in character. And from whom you can get this portrait is nothing but the patient himself, the attendants, and third one, the physician. And we have added one more thing from the modern point of view, the laboratory investigation. And we get the total portrait of the disease. It is as good as the same picture of the individual as it is. But portrait is consists of many things. It consists of the normal things as well as it consists of abnormal things. We have to take into consideration whole things when you deal with the patient with the portrait. But this sometimes, because of portrait, you are jumbled. Because the confusion happens when you get many things together. And from that, you have to select certain important things. So, today we have to learn and go ahead with the seventh aphorism, where he mentions what is important out of that portrait and what you have to remove, what you don't have to never take into consideration when dealing with the patient. So he starts seventh aphorism in a right manner, and what he explains, now as in disease from which no manifest exciting or maintaining cause, causa occasionalis, has to be removed, we can perceive nothing but the morbid symptoms. What he says, first you have to remove the causa occasionalis or exciting cause from the case. If there is a patient who comes to you with a chronic cough, and when he is suffering from chronic cough, irritating cough, allergic cough, and if that person is a chronic smoker, that cough is definitely because of the irritation which is caused because of smoking. That is not a chronic disease. That is just a maintaining cause which is creating a recurrence, which is creating irritation inside the throat and producing the cough. So that is nothing but the maintaining cause or causa occasionalis. And if you remove the causa occasionalis, that will automatically going to be settled. Then there never remains the totality. Then there never remains the symptoms. So when you remove the exciting cause or when you remove this causa occasionalis, then whatever remains is important for you. So first thing which you have to remove from that is the causa occasionalis. So has to be removed. We can perceive nothing but the morbid symptoms. Morbid means disease symptom. It must regard being had to be possibility of miasm and attention paid to the accessory circumstances, aphorism 5, to be symptoms alone by which the disease demands and points to the remedy suited to relieve it. So after removing basically this causa occasionalis or exciting cause, generally if it is a disease which is produced because of maintaining cause or causa occasionalis, it will automatically disappear. There will be no symptoms. And if after removing the causa occasionalis and exciting cause, if the still symptoms used to remain, then you have to treat those symptoms with the help of a right remedy. Then you have to give so much of importance to it. Then you have to find it out a right remedy. And whatever is expressing, that you have to take into consideration. So totality of the symptoms is the thing which remains after removing of the maintaining cause and causa occasionalis. And now he says, points to the remedy suited to relieve it, and moreover, and now he defines the totality. Just underline this definition of totality, and this, if you are a student, it should be marked up as it is. जशी दिली तशी तशी पाठ करायची. The totality of the symptoms of this outwardly reflected picture of the internal essence of the disease, that is of the affection of vital force. So this is the definition as defined by Hahnemann. So this is the part which he defines over there. He explains it is an outwardly reflected picture of the internal essence of the disease. So disease is essence, and where it lies? It lies inside. It lies in the dynamic plane. It lies at the vital force. And that disturbance of the vital force reflects outside. And that totality, whatever comes out, is very important for the finding it out a right simillimum. So everything which you don't have to take into consideration when you deal with the patient, but you have to take into consideration first the totality of the symptom, which guides you towards the specific state of that individual. So you have to find it out a totality, and that totality guide you to a right remedy. What he further says, of this outwardly reflected picture of the internal essence of the disease, that is of the affection of the vital force, must be the principle or the sole means whereby the disease can make known what remedy it requires. So what he says, it is the only thing which defines what remedy it will going to, patient will going to require. It is the language of the disease. The expression of the disease in the form of signs and symptoms is nothing but the language of the disease, and disease lies inside. Disease is inside. Disease is at the dynamic level. You cannot locate it, you cannot find it out, you cannot find it out with naked eyes, you cannot find it out with any investigations, because it is invisible entity. On the basis of cause and effects, you have to judge, yes, it is there. Cause is something which is again invisible, but manifestations are visible. They are either in the form of signs or they are either in the form of symptoms, and that constitutes the totality. And that totality is the guide for the remedy. So it is the sole guide. What he used, the word is very important. The sole means whereby the disease can make known what remedy it requires. The only thing that can determine the choice of the most appropriate remedy. And thus, in a word, the totality of the symptoms must be the principle, indeed the only thing the physician has to take note of in every case of disease, and to remove by means of his art. Again, one more word, underline, by means of his art. Art is very important word which you have to underline. In order that disease shall be cured and transformed into the health. So you get the totality of the case. Totality you can get when you deal with the patients in a proper manner. To get a totality, to get a right case is a very important thing. You require a good communication skills in order to achieve a good totality. Because patients, they are reluctant. They never want to discuss anything with you. They are familiar with the allopathic mode of case taking. And those people never give so much of time. They never entertain the patient. And that's why patients who are familiar with that mode of case taking, they feel something odd. If you are asking the details, they feel what is the relation of my disease and whatever the questions asked by the physician. And that's why this becomes an art. You have to deal with the patients with your artistic way. You should develop that art, how to get communicated with the people. And once you get communicated with any person, you can get all the information what is needed for your prescription. You will get all the information to reach to the right similitude. And that's why he explains over there, it is an art. So it happens many a times. What has happened once I used to conduct the workshops. In 2007, that there was the first workshop conducted by me. And what we used to do in workshop, there are behind every 4 students, there was a live case. And one is the group leader of all those 4 members. One is the group leader who knows the case taking or all those things, who used to remain a group leader. And on day one of the group leader, she went over there, she taught to the all rest of the 3 members how to deal with the case. And there was a young girl, a small child, she was just around the 3-4 years or 4-5 years. And that group leader asked many questions. What is your name? What is your problem? What is your age? Everything. And that girl, she was too obstinate. She never answered a single word. She never told the name. She never told the full name. She never told the age. She never told any symptom, anything. And ultimately, the group leader, she was frustrated, but in an elevated mode, she came to me to show the case. And she said, sir, this is Barata child. She has not given any answer. Absolutely not even told her name. Whatever information we gathered is from the mother only. So give her Barata. This is pure case of a Barata. So this has happened. So I looked toward that child and I offered the just globules. Do you like it? She said, yes, I want. I have given 4 plain globules. She was too happy. Do you want more? She said, yes. Tell me your name. And she narrated immediately the name. Then I have offered 4 more. And then I asked many questions and whole case taking I got from the child. Then I asked the question to the group leader, where is Barata now? Now you are Barata because you are not able to reach to the right case taking. Case taking is an art. Understanding the patient, making a communication with others is an art. So it is not a science that you start the case taking with the questionnaire and you do it in a mechanical manner like you do in colleges. So it should not like that. And there are many more who used to do the mechanical case taking. They never think behind it. What is the purpose? For what purpose they used to ask? And that's why sometimes they are in their own trance and they goes on whatever is question written over there. They used to ask the patient, what is your name? It is written on the case paper. What is your name? Then they ask, what is your age? Then they ask, what is your sex? So the problem arises at that time because it is mechanical case taking. So such a thing should not happen. It is an artistic way with which you can get communicated. And this is what Hahnemann wants to explain, that this is first art is to get the totality. And second art is to find it out right similitude. 2 important things. To get a case is an art. At the same time, find it out a right remedy from the finding it out anti-type totality, and to reach to the right simillimum is another art. Because even though you have ample knowledge about the homeopathy, but if you don't have an art of reaching to the right remedy, then your practice never comes out. You have to understand. You have to understand what is wrong with the patient. So that is what Hahnemann has explained while explaining the qualities of the homeopathic physician, and he explained over there that knowledge of disease and what is wrong with the disease, that is what he wants to ask. So you must able to understand what is wrong with the patient, what patient will require, and then you have to go ahead with your weapons. So this is too important. So many a times you have to first understand what is wrong with the patient, and that is an art. I will ask you a remedy. I'm damn sure you are all of you are brilliant. I will give a picture. You tell me the remedy. Okay. A 7 months child was brought to you with involuntary urination, bedwetting, and she was too obstinate. Whatever she picks up, she never leaves. She used to sleep on abdomen. She used to cry a lot. She was quite irritable and obstinate. And she was brought for the bedwetting problem. So if you observe that she was very happy when carried, everything was fine, and she's there in front of you. So what remedy you will going to prescribe for that child?
Chamomilla.
Okay, any other solution? Yes, Dr. Uma, she said chamomilla. Salma Sheikh, chamomilla. Effect, chamomilla. Very good. Any other remedy? Only one remedy, chamomilla. You are damn sure about it. Basically, for what purpose she was brought? She was brought only for the purpose of bedwetting. 7 month child bedwetting is common. It is not abnormal. So first important thing is important thing is that you have to understand what is there, it is wrong. Is there anything disease? If it is disease, then you have to treat. If it is not a disease, you don't have to treat. So this is too important to understand. This is what you have to look for. So your totality should not be like that. That will be an idea. That will be the totality which covers healthy symptoms. These are not the things. And this is what Hahnemann wants to explain, that portrait is one part, totality is one important part of the portrait of a disease. And then if you really get a patient is having a disease, then the totality, you have to find it out a right remedy with the help of that totality. So to find it out a right remedy for the patient is an art. To get a right totality is also an art. So these are the things which you have to look for, and this is what he wants to explain now over there. Two important questions are there. First is causa occasionalis over there. Always asked in the examination. Causa occasionalis is nothing but the maintaining cause of the disease, and maintaining cause is anything which used to maintain the disease. The causes which used to maintain the disease is the causa occasionalis. And many more examples of causa occasionalis are mentioned by the Hahnemann over there in the footnote. There is a big footnote to it. I think footnote number 3, which is related to the causa occasionalis, examples of causa occasionalis. So we'll read that footnote number 3, where he explains many causes of the causa, examples of the causa occasionalis. It is not necessary to say that every intelligent physician would first remove this where it exists. So what he will remove? He will going to remove the causa occasionalis first. So if the patient who is there in front of you, heavy smoker, it is your duty to remove the smoking before you treat his cough. If the patient who is suffering from acid peptic trouble and who used to consume very spicy diet, it is your duty to remove the spicy diet. That is more important. And then you have to treat that patient. So these are very essential things. The indisposition thereupon generally ceases spontaneously. Indisposition, another short note. A short note topic. What is indisposition? It is the slightest alteration in the state of health caused because of some exciting cause is called as an indisposition. So a person who has consumed very spicy pav bhaji at night, in the morning suffered from severe vomiting and burning, retrosternal burning. It is just because of that spicy food. So what you are going to do? There is no need to give immediately a medicine unless that indisposition is of a severe character. Indisposition of a mild character never requires any medicine. So just wait for some time, ask the patient that he should take a bland diet or he should not take a diet for one session, and then automatically it settles because body has that capacity to recover. So this is what you have to remove. So what he says over there, thereupon generally ceases spontaneously. He will remove from the room strong smelling flowers which have a tendency to cause syncope and hysterical suffering. So one first example he has given is that strong smelling flowers can be responsible to produce sometimes syncope or sometimes even the hysterical suffering. Extract from the cornea the foreign body that excites the inflammation of the eye. This is too simple. There are many patients who used to, if you are doing practice nearby any, what you can say, MIDC area, you get ample patients of those who used to get a foreign body in their eye. And then if patient is coming to you with a severe lacrimation, with burning, he wants to rub that, it irritates the eyes. And if you consider that this is the picture of euphrasia, it is wrong. You have to look whether there is any foreign body. And if it is foreign body, you have to remove that foreign body. If it is in the conjunctiva, you have to remove it. Even though if it is cornea, you have to remove it. But things should be known to you that if you want to remove the corneal foreign body, keep the eye closed for 24 hours after removing that. Healing of the cornea requires 24 hours. And within 24 hours, it heals, and thereafter there will be no problem. If you don't apply anything over that, then definitely it leads to a suppuration, and whole cornea there remains a scar forever, and person has a disturbed vision. Then patient might require in future the corneal transplantation, a big surgery. So keep it in your mind, when you remove the corneal foreign body, keep the patient's eye closed for 24 hours totally. So there should be iPad should be given, and it should be totally crossed for 24 hours. Another example, loosen the over-tight bandage on the wounded limb that threatens to cause the mortification and apply a more suitable one. So there is one habit. If there is a pain in anywhere, the old people, they used to tie a bandage over there, and they used to tie it very tightly, because tying it too tightly removes the sensations over there and patient feels better. The pain disappears because of it. But that may cause that further blood supply can be cut off. And if further supply of the blood is cut off, then what happens? Then there might be a swelling, there might be edema. If the lymphatics gets compressed, there might be further edema. Unless and until you loosen that tightening bandage, it is not possible to remove that edema. So this is what one thing which you have to look for. See, he has given very good and simple examples. Lay bare and put a ligature on the wounded artery that produces fainting. So if patient comes to you with wounded artery is broken, and patient bleeding a lot, giving phosphorus is not of any use, or not arnica is not of any use. It is the duty of the physician to immediately tag that specific artery. So you have to stop that bleeding with the help of some surgical measure, or tie up that artery so that it will be stopped. Endeavor म्हणजे प्रयत्न करणे. Endeavor to promote the expulsion by vomiting of belladonna berries, etc., that may have been swallowed. accidentally anyone ingested belladonna berries used to produce severe abdominal cramps, pain. Unless you remove them by producing vomiting, which is in Ayurveda, it is called as the vermin, or if you can do it by giving the salty water that can be thrown away as a vomiting, that colic will not stop. That is very important thing which is explained. Extract the foreign substances that may have got into the orifices of the body, the nose, the gullet, the ear, the urethra, the rectum, the vagina. And these are the things. The children, they used to go for such a thing. When I was practicing in earlier days, when I was not just doing the consulting, but I used to follow with my father also, I have seen many patients, many children who used to put the groundnuts inside the nose. And then it is the art with which we have to remove that. No medicine will going to take the groundnuts outside. This is too important. These are the things which you have to develop. Here, medicine is not important. You have to remove that foreign substance from that area. Crush the vesical calculus. See, important thing which he has mentioned. Hahnemann explained, crush the vesical calculus. If it is a big calculus or if it is staghorn calculus, your medicine will not take it away because it is not possible. If it is of a, I have seen one patient in whom nearly about there was a staghorn calculus about 1 inches inside his kidneys. How can it be possible to remove that with the help of medicine? Here you have to tell the patient that this is purely a surgical disorder where it should be removed. Hahnemann also explains the logically. And last point which he explains over there, open the imperforate anus of the newborn infant. Yes, no medicine will produce anus formation over there. So it is naturally, even though you know that this is syphilitic miasm is dominating, but medicine will not going to make it. You have to do a surgical intervention. And this is too important. You have to understand all those things. So many times you have to understand what is wrong with the patient. Really it is a dynamic disease, or really it is a pseudochronic disease, or really it is a artificial chronic disease, or whether it is a true surgical disease. That first you have to judge. You cannot immediately come to the conclusion and find it out a right remedy for the patient. And basically doing this is wrong. First you have to understand what is wrong, what you have to treat, how to treat. All those things matters a lot. And this is what he is explaining over there in that footnote, giving maximum examples of maintaining causes or causa occasionalis or exciting causes. So this is one part. One must understand the exciting cause. While writing down the answer, you have to give first reference, then what is the meaning of causa occasionalis, then explanation of causa occasionalis, then how to remove the causa occasionalis, and how patient benefits of removing the causa occasionalis. That's all you have to write in your answer. And then when you write the totality of the symptoms, this is the one definition given by Hahnemann. It is an outwardly reflected picture of the internal essence of the disease, that is of the affection of vital force. That is one definition you can write by giving the reference in the 6th edition of Organ of Medicine, in the Aphorism number 7, Dr. Samuel Hahnemann defines it. But at the same time, if you want to score more marks, you add 2 more definitions. One definition by J.T. Kent. What Kent says regarding the totality of the symptoms is very simple. He says that it is the sum of all characteristic symptoms is called as the totality of the symptoms. So he says it is not all the symptoms, but sum of all characteristic symptoms. And Kent is very right one. So that you never have to look for the common symptoms, you have to look for the characteristics of the case. And third definition is Boningussen's definition. He defines it in a similar manner, that it is the sum of all complete symptoms is called as totality of the symptom. So if the symptom is complete, which has a location, which has a sensation, which has a modality, which has a concomitant, automatically it becomes characteristic. Automatically it defines you a right remedy. So all these three definitions you can write in your answer, and that gives a very much value to your answer. So with exam point of view, these things one should keep in your mind. From practical point also, when you deal with the patient, you must know all those things. So we have finished up to this, and there is one more footnote still remaining to this paragraph, footnote number 4, but it is the exactly opposite, related with the antipathy, what Hahnemann have explained. So in the earlier aphorism, in the seventh aphorism, he explains in homeopathy, we deal with the totality of the symptoms, and exactly opposite state, the opposite thing, which is there when you deal with the antipathy, they gives importance to the single symptom. So in this footnote, he explains about the single symptom, and this is the in comparison with the antipathy, how homeopathy treats the patient permanently. That aspect he has explained. Tomorrow we'll learn this footnote number 4, and then we'll go ahead with the aphorism number 8. So till that period, we'll stop, finish the session. Uh, Yesterday's question, there was some question asked by someone. If it is there, we can. Sir, how to treat different degrees of burn and reduce the burn scar? Burns, how much, how much burns are there? How much percentage of burns are there? That is first important thing. Second important thing, if it is below 30-40%, then patient will not require admission. You can treat it. If it is below 30%, you can treat it on the just OPD basis. Two important things. You have to find it out the remedy for the patient. That is first important thing, depending on his totality. But if it is an acute burn, to tackle that burn, giving cantharis orally matters a lot. It removes the pain very fast. So cantharis internally is very important. If there are blisters, then it may lead to the ulcerations, and those ulcers can be healed very properly with the help of calendula. And my suggestion is that calendula mother tincture, instead of calendula mother tincture, in such types of cases, calendula ointment is useful, because calendula mother tincture immediately gets dried up. If you apply calendula ointment, and I suggest always the SBL calendula, it is the only calendula ointment which, when you apply, it gets dissolved over there. Other preparations which I have seen, they remains as it is. Calendula by SBL is very properly prepared ointment. You can get the smell of calendula in the ointment. And when you apply calendula ointment, it immediately, it starts dissolving, it acts over there. And that's why calendula ointment is a better ointment to reduce the burn scars. It is a very good one that you can do. Second important thing, that if patient has certain symptoms, find it out a right remedy for the patient. You should not fix your remedy. It depends. It varies from the patient to patient, but cantharis to tackle the acute pains is very important. If it is burns long standing, then you have to find it out whatever the patient's remedy, that remedy is you have to give to the patient. There was one question, sir, what are positive general symptoms? Positive general, it is not positive general, it is the physical general or mental general. General symptom is a general symptom which is related to the person as a whole. Negative general, do you know what is a negative general? Yes, negative. If you remove the negative general symptoms, then whatever remains are called to be a positive general symptom. This is too simple. So what is negative general? Anyone? Any idea? If in your case, if the expected symptom is absent in that case, that is called as a negative general symptom. That is very important, that one must understand what exactly it means. When a, when a symptom which you expect that this should happen in the patient, this should be there, but if it is absent, then that is called as a negative general symptom. So, yes, Dr. Uma, she has explained, if the patient is having the fever and during heat stage, the patient should be thirsty. This is expected. And if it is absent, it has a meaning. Then you can think of a belladonna. It becomes a negative general, but which defines the remedy. So, this is the answer. And second important thing, that's we will stop it over here because less than 1 minute is remaining. Tomorrow we'll meet again. Thank you very much. And we'll continue with